Welcome back to Washington Journal. I'm joined now by a panel. Dr. Robert Pearl is the former CEO of Permanente Medical Group, and Dr. Joel Zinberg is a senior fellow at the Competitive Enterprise Institute. We're talking about the Affordable Care Act. Gentlemen, welcome to the program.
Morning.
Good morning, Mimi.
So I want to ask you both. I'll start with Dr. Zinberg. The ACA was signed into law in March of 2010. What do you think has been the single most biggest success or failure of that law over the past 12 years? Dr. Zinberg.
Well, there have been multiple failures, in fact, from the ACA, but I would say the biggest failure is the failure to insure as many people as were promised. The Obama administration promised about 25 million additional people would gain insurance. It never even approached that. It was generally more in the order of, somewhere between 10 to 15 million, depending on the given time. And most of the people who gained insurance through Medicaid, which is a sort of inferior form of insurance with poor access to care. So it did not deliver what it had promised to deliver in that score, and in many others.
And what about you, Dr. Pearl?
The biggest success was the expansion in coverage. These about 10 to 12 million people, individuals in the exchanges, many of whom had pre-existing conditions, who were excluded from coverage, who now had coverage. And an additional group in Medicaid. I estimate the total number is somewhere between about 16 and 20 million. The biggest challenge, and I said it at the time, was that the legislation didn't address issues around improving quality or making care overall more affordable. That's at the delivery system level. I wish it had, but it was a political compromise at the time required to get it through Congress.
And Dr. Pearl, do you think that the ACA has made healthcare more affordable?
No, it hasn't changed the delivery system. What it really has done, and I agree with Joel, it's really expanded it to people who otherwise couldn't get coverage. You couldn't get it because you were too poor. There's no way you can pay a premium if you're making $30,000 a year and your employer doesn't offer it, or because you had pre-existing conditions and the insurance industry excluded you, and now you can access it. But the underlying delivery of care, the doctors, the hospitals, the drug companies, the ACA didn't touch that. Congress right now has it. I believe that it should. I believe that we need to change the underlying American healthcare approach, but that's an entirely different piece of legislation.
All right, and viewers can call in and ask your questions to our panel. Our lines this time are, if you have ACA insurance, Affordable Care Act insurance, you can call 202-748-8000. If you have private insurance, 202-748-8001. And if you're not insured at all, you can call 202-748-8002. All others can call us on 202-748-8003. You can also send us tweets and see us on social media. Well, Dr. Zinberg, do you think people have more options now with their health care because of the Affordable Care Act?
Well, they do, in some regard they do, but basically they do not, because a lot of the individual options that they had prior to the ACA were basically eliminated. There's now what's called the minimum benefits package, which requires people to buy a particular type of insurance, whether they want it or not, whether it suits them or not, whether it's more insurance than they need or not. And I think that that's reflected in the fact that the young and healthy, who the ACA were counting on to buy insurance and subsidize the elderly and sick, were not enthusiastic about the ACA, did not purchase exchange plans. And as a result, you never had that expansion that was promised. The expansion of people who signed up on the individual exchanges was offset by people who left other types of individual insurance, could no longer get it, and by people who lost employer insurance coverage. So the bulk of the newly insured were people who got their care through Medicaid. So people, the promise that you can keep your doctor, you can keep your insurance, that was not fulfilled. The promise that your premiums will go down was not fulfilled. Premiums on the ACA exchange plans have more than doubled since the ACA started to be, initiated back in 2014. And the only reason people sign up on those exchanges at all is because they're heavily subsidized. Very, very few people who are not subsidized are signing up on the exchanges. And that's because the exchange premiums and premium and deductible, which is really your entire cost, has really skyrocketed.
I want to show you a clip from our archives, the C-SPAN archives. Looking back historically, this is President Obama in 2010 signing the bill into law. Take a look.
The bill I'm signing will set in motion reforms that generations of Americans have fought for and marched for and hungered to see. It'll take 4 years to implement fully many of these reforms because we need to implement them responsibly. We need to get this right. But a host of desperately needed reforms will take effect right away. This year, we'll start offering tax credits to about 4 million small businessmen and women to help them cover the cost of insurance for their employees. That happens this year. This year, tens of thousands of uninsured Americans with pre-existing conditions, the parents of children who have a pre-existing condition, will finally be able to purchase the coverage they need. That happens this year. This year, insurance companies will no longer be able to drop people's coverage when they get sick or place They won't be able to place lifetime limits or restrictive annual limits on the amount of care they can receive. This year, all new insurance plans will be required to offer free preventive care. And this year, young adults will be able to stay on their parents' policies until they're 26 years old. That happens this year.
All right, well, Dr. Pearl and Dr. Zinberg, let's start hearing from some of our viewers and taking their questions. Wynn is first up in Cumberland Center. Go ahead, Wynn.
Hi, good morning. Can you hear me?
Yes, I can. Go right ahead.
I don't know where to start. I had a PPO when I lived in Florida, and I received it when I was about 30. And I just have changed my residency to Maine. And so consequently, now I have the ACA. And I don't know where to start. It's, you know, it was affordable before when I had a private health insurance plan. And now I pay more and I receive nothing. I have to pay everything out of pocket. And as far as my deductible, it's $3,500. And then it goes up to $8,300. So basically in a year, I have to pay like $8,300 before my insurance picks up anything. And now, in the state of Maine, Anthem is no longer going to be accepted at Maine Medical Center. So consequently, that's where I would go if I had an issue. Apparently, they're going to cover you if you get into an accident. So it's quite confusing because Anthem hasn't reached out to any of their customers. And it's on the news, but it's up in the air. I don't know. It's a mess.
So let's get a response when Dr. Pearl, I wonder what you think.
It's so hard to sort out the broken system of American healthcare that, as Wynn said, varies from state to state. I can't tell what's going on in her situation. She should have, through the ACA coverage. A lot depends upon her income, how much is subsidized. As Joel said earlier, one of the biggest challenges is that Americans can't afford to purchase health care. And the program that's put in, that's an insurance program, is going to make them responsible for the cost, which, by the way, in the United States today averages over $12,000 a year. That's just not affordable for the typical person earning, let's say, $30,000, $40,000, $50,000 a year. And Wynn may be caught in those cross wins. I don't know that it would be any better if she tried to get the same PPO from Florida. We need to have a much more consistent and better national health delivery system plan.
All right, let's talk to Quito in Rockville, Maryland. He's on our line for all others. Quito?
Hi. I remember what it was like before we had the American Health Care Act. And I remember I was making about maybe $60,000 a year as a software developer. And I remember my insurance, my deductible, or rather my monthly payments had gone up to like $800 a month. And that was just for me and my family of, there were three of us. And I just remember it was killing me. You know, it was a lot of money, and that was before Obamacare. And I remember before Obamacare, the cost of health care was just, one year it would be one thing, the next year it would be like 40% higher, and the next year it would be 40% higher. And it was like the health care costs were just spiraling out of control. So what I remember, right, I remember when Obamacare came, all of a sudden it forced the healthcare people to lower their stuff, because all of a sudden then the costs went down, right? And what I pay now today, I mean, you know, I think, you know, I pay significantly less. You know, I mean, I actually make more money. You know, it's been X amount of years, right? But I make more money, but I pay less for my family. You know, so there's something there. I think people are having different, you know, things. And in reference to the other lady, Gwen, I think there's more there. You know, there are more details that she would probably have to go ahead and say why, because I know there are different levels that you can choose with the American Health Care Plan. So I would wonder what level she's on. If you choose the cheapest one, you have to pay the most out of pocket. You know, and a lot of your expenses that are just normal expenses are automatically covered. But there's a lot of, I believe, good that came from the American Health Care Plan, despite the fact that many politicians, being politicians, also known as used car salesmen, they tried to gut it as much as they could. It actually helped, I believe, more than anything else. Does it need more work? Absolutely. Absolutely. But, you know, it really helped a lot. So that's just what I wanted to say.
All right, let's get a response. Dr. Zinberg, what do you think of that?
Well, I think, you know, what Gwen experienced is sort of typical. The plans that are offered on exchanges are usually quite narrow. They only cover a limited number of providers. So she's finding that a major healthcare provider in her area is not participating in the plan. And very often these plans to cut costs don't include the premier providers in their area. So for example, in Texas, there are no plans that cover MD Anderson Cancer Center, the leading cancer center in the country. She's also experiencing the very narrow choices that she has. More than half of the counties in the country don't only offer one or two plans to choose from on the ACA exchanges. So you don't have much choice. So you're very limited. And what's happened is they've replaced a system where people had a lot more options, where they could go for cheaper plans, for plans that weren't quite as inclusive. And there were a number of initiatives in the last administration, things like short-term plans, association plans, health reimbursement arrangements, which would improve the people's opportunity to choose the plan that works best for them. But instead, now people are locked into these specific plans on the ACA exchanges, and insurance companies aren't that enthusiastic about it.
All right, Bob is in Philadelphia, Pennsylvania, and has private insurance. Good morning, Bob.
Good morning, C-SPAN. Thank you for taking my call. Yes, I have private insurance, and yes, I'm getting hosed I'm going to pay the first $8,700 because I don't qualify for the ACA. And I don't begrudge people that are on it because I actually have a son who is on it, who benefits from it. But again, it's income redistribution. But there are two specific questions I'd like to ask your guests. And the first is the burden that Medicaid has had on rural hospitals. If they could address the rural hospitals that don't really have great world-class, say, cancer or cardiac care to float their hospital, what Medicaid has done to those rural hospitals. And the other point is, what in the world has the 26-year-old freeloading off their parents, what has that done to premiums? And what incentive does it have for kids to go out and gainfully get their own so that they could, make a life for themselves? If, your two guests could answer, about those two things, I'd appreciate it.
Okay. Let's start with Dr. Pearl.
I want to speak about the reality of healthcare, and Bob has done a great job, as Keto did, of talking about how expensive it is for Americans today, and that's not an insurance issue. And ACA, for the most part, is about insurance. It's the care delivery piece. So to Bob's question, when you expand coverage and include people to the age of 26, you have more people being paid by the employer. And what you see is going to be higher costs that could be simply paid at the business level, or it could be paid by others who are covering themselves and then through their kids, through their family, till they turn to be 26. In the rural areas, the issue is Medicaid. We don't pay enough. California, where I am right now, pays about 60 cents, 70 cents on the dollar for Medicaid patients. You can't deliver care when you're only getting paid 60 or 70%. These are social issues, congressional issues, and I think the underlying theme is the ACA was a step in the right direction, but not fully there. And I'll go back to the same theme, and people can check robertpearlmd.com, my website, where I talk a lot about this. We have to change the delivery system if we want to make American healthcare work, whether it's through the ACA, whether it's provided through an employer privately, whether it's offered through the government. It doesn't matter. It's basically a system that is way too expensive, inefficient, with quality, according to the Commonwealth Fund, that is last amongst the 12 most industrialized nations.
All right, and Dr. Zinberg, any comments on either of Bob's points about the burden of Medicaid on rural hospitals or the 26-year-olds he says are freeloading on their parents' insurance?
Well, I'd hardly call it freeloading, but I would say that that provision of the ACA that required insurers to offer insurance up to 26-year-old on the parents' policy was great for the insurance companies. They were thrilled with that because those folks are inexpensive to insure. They're healthy. And because the ACA required community rating, you can no longer rate on risk. They were getting actually higher premiums for those people than they normally would, because the whole idea of the ACA was to have the young and healthy subsidize the elderly. So that was a win for the insurance companies there. Now, granted that some kids did gain coverage, but I'm just saying it was sort of short-sighted in that regard. Regarding rural health care, that's been a problem regardless of the Medicaid issue. Medicaid is a federal state program where they share the costs, and the federal government subsidizes at minimum 50%, often up to about 75% of the costs. But the problem with rural health is simply that providers don't necessarily want to be there, and there's too few providers in any given area. The ACA did exacerbate that problem, though, because it said that because of the new Medicaid expansion provisions, they were actually going to get rid of some of the other subsidies that were called under the title of DISH We're going to get rid of some of those subsidies that existed for hospitals that delivered care in underserved areas. So it actually made the situation a bit worse for rural hospitals and worse for the people who depend on rural hospitals.
Let's take a look at a few numbers on the ACA marketplace from 2014. That started at 8 million people enrolled, and at 2022, we're at 14.5 million. Those numbers steadily rising. Let's talk to Alicia in Columbia, Maryland. Alicia, you're not insured. Why is that?
I guess I called on the wrong number.
Okay.
I'm insured, but is it all right if I speak to you, even though I call on the wrong line?
Go ahead, Alicia.
You must be a new moderator. Welcome.
Thank you.
And to your guests, good morning. Good morning, America. When Affordable Care Act came into being, what happened to my insurance was the money we got for Medicare, for our medicine, Obama took that out and gave it to his Affordable Care Act. And when I had long-term care, and that was agreed upon that my, what do you call it, when you have what you pay into it.
The premium?
Well, that increase. And I tried 3 members of Congress from Maryland and then one from Tennessee. I called them and I called them because that had increased, and I couldn't get any of them respond to me, and that was very unfair.
All right, Alicia, let's get a response on the rise in premiums. What do you think, Dr. Zinberg?
Well, I'm not sure exactly which part of medicine she's talking about. If she's talking about the Medicare Part D plan, which covers prescription drugs, if that's what she's talking about, that plan actually started prior to the ACA, and it's been amended and changed and manipulated several times since. So it's not necessarily so much an ACA problem, but in terms of premiums in general, the ACA had the Obama administration, when rolling out the ACA, had promised they would save $2,500 per family on premiums, and just the reverse has happened. The premiums have doubled since the plan started. So premiums have soared, but so that's just one of the broken promises. And one thing I think is worth reminding the viewers is that the ACA ensures about the exchanges and the Medicaid, the total increase, it ensures about 6% of the population. We're very excited and celebrating, and we've had all sorts of battles for the last 12 years about the ACA, but it covers really a small fraction of the people in this country. Employer provided insurance still covers the majority of people in the country. That's a much bigger issue when we're talking about the health of the nation than the ACA is.
Well, let's take a look at Republican Congressman Ted Budd. He was on Newsmax TV this week talking about the ACA anniversary.
I don't know if I would use the word celebrate, maybe mourning. Just our office gets inundated with calls saying they can't afford. These are people making $40,000, $50,000 a year, and the lion's share of their income is consumed by what Obamacare has essentially created. And now it looks like Biden is bringing in Obama to distract from the dismal failure that Obamacare is. Look, this is things like, if you like your plan, you get to keep your plan. And we realize that was now the PolitiFact 2013 lie of the year. The counties in North Carolina are limited to maybe 1 or 2 plans. So it's really hurt the consumers and limited their choice.
All right, let's go back to our callers and talk to Kelly in Longview, Texas. Good morning, Kelly.
Good morning. I just have a couple of quick points. I'm disabled and on Medicare, and I'm 60 years old now. I've been on Medicare for a few years, and the problem I have is I was going to get a supplement to where it would cover my 20% out of pocket on all expenses, doctor visits, and everything. However, because of pre-existing conditions, being disabled, I'm unable to purchase a supplement. So I'm on a low fixed income, and I have to pay 20% until I turn 65, and then I'll be eligible for a supplement. And the other comment is in my area, we have a lot of new, innovative emergency rooms popping up with state-of-the-art equipment, new doctors coming in, but they don't take Medicare because they told me it takes about a year to get their money, paid to them for services. And that's all. Thank you.
Any comments, Dr. Pearl?
Kelly's raising a crucial point, and this is the last piece of healthcare today where because you have pre-existing conditions, you can be excluded. The thing to realize is that prior to the ACA, that was a common event. In fact, insurers figured out how they could maximize their profit by being able to find the healthiest people and exclude individuals who are likely to need medical care. So I think that Kelly's situation was the typical problem for Americans before the ACA. Much of that has been resolved, but going back to what Kelly has said, I think the issue is really going to be, how do we make healthcare affordable for people earning $40,000 or $50,000 a year? And today in our nation, it's not, whether it's insured through the Affordable Care Act or paid for by the individual.
Now, I do think that the whole issue of people with pre-existing conditions was greatly oversold prior to the ACA. There were some people who had difficulty, but not the tens of millions that were advertised. And if that was really the major issue, then the ACA should have addressed that issue head on by creating either a risk pool or a particular type of insurance for folks who had difficulty getting market insurance because of their pre-existing condition. But instead, the ACA decided it would upend the entire system and destroy the individual plans that were available that some of your callers depended on prior to the ACA. So it created a brand new system to address what was really a much smaller problem than advertised.
Let me dive in, because Joel's mentioned a couple of times the plans of before. I mean, a lot of these plans paid so little that you thought you had insurance, but you didn't. A good example is they excluded pregnant women who needed to do delivery. Now, I don't know how many of your listeners have delivered a child lately, but there's no way individuals can afford to make those payments, particularly early in their life when they tend to have the babies, without having that kind of insurance. You can exclude a lot of conditions before that simply made it look, it was the illusion of coverage. And I think what it did is it raised that bar. And did that raise the cost? Absolutely. But did it provide the coverage to the people when they needed it? I mean, again, I see the negative sides of the Affordable Care Act. Don't get me wrong. But I think we have to give it credit for where it took care of stains and blots on our healthcare system and made coverage better. But even then, we've heard from the listeners today, the out-of-pockets are so unaffordable, whether in the ACA or outside the ACA, $5,000, $6,000, $8,000. That's just not possible. And so we have to have listeners understand there's the insurance coverage and the delivery system. And if we don't address the delivery system of American medicine, everything, including the ACA, will be unaffordable.
Let's drill down a little bit on that. What do you mean by the delivery system, and what needs to change about that?
Sure. It's the amount of dollars that we spend. Today, it's $4 trillion It's almost 20% of our total gross domestic product, the total dollars we spend on everything. 2 weeks ago, or last week even, the government released numbers. It said that the cost of healthcare was going to rise 5 to 6%, and that's without considering inflation and supply chain or all the issues happening today. This is going to be $2.5 trillion more dollars over the next 10 years that the nation is going to spend on healthcare. It's going to become 7 trillion or maybe even 8 trillion when you factor in these other pieces. We just can't afford to spend that, and just simply providing insurance coverage at that rate is going to affect businesses and individuals and families and other services. So we have to address that. And that, to me, is the greatest problem with the Affordable Care Act. It didn't take on the inefficiencies of the cost of delivery, whether at the individual doctor level or at the insurance level. Now, don't have any listeners get me wrong. Our physicians work incredibly hard. They're working in a broken system, but if we can't change the system of healthcare in the United States, how care is delivered, and make it more efficient, then almost no one's going to be able to afford it.
All right, let's talk to Barbara. She has ACA insurance, and she's calling from Cape Girardeau, Missouri.
Good morning.
Good morning.
I'm in Cape Girardeau, Missouri.
Girardeau.
I do not have ACA insurance because there is no such thing as ACA insurance. ACA is a law that affects all insurance. The insurers on the exchanges are private providers. Private providers decide premiums and deductibles. The ACA is a law that helps protect Americans from being victims of insurance companies. Please stop calling it a provider. Thank you.
Okay. Dr. Pearl or Dr. Zinberg? Any comments?
I agree completely with Barbara. She said it exactly right. It is not the care delivery. It is a coverage mechanism. And as she said, particularly for individuals, it's delivered through insurance companies that have the ability, as they do elsewhere, to set the premiums and to set the terms in which the care is provided.
Yes, but they do set the terms that the care is provided and the premiums within very strict guidelines set up by the statute. So there's a limit to what's called the medical loss ratio. There's the minimum benefits package that has to be offered. So that's really the reason why you get so few insurers who are willing to participate on these exchanges that were set up by the ACA, because they are so restricted. I agree with Dr. Pearl that we do need change, but although I suspect we would disagree on the change we need. The way to drive down costs and improve the quality is to improve choice and competition. If you're locked into very rigid government guidelines, it becomes very difficult to innovate, very difficult to offer plans that people actually prefer. And as a result, people don't buy the plans. If it's more insurance than they are interested in or that they feel they need, they will not buy it. So for example, when one of your callers talked about he saw a lot of emergency care centers or these sort of walk-in clinics opening up, those are folks who are setting up a sort of a market type arrangement where they're not accepting Medicare, but they are offering a medical service for people who can afford it or seek it out. And over time, what happens there is that if you get enough competition, that will drive down costs. The problem with our system now is it's set up to discourage competition. The ACA and other statutes placed all sorts of mandates on providers that ended up encouraging them to combine and consolidate. So you have medical centers combining with one another. You end up with very few providers in any area. And when you have that sort of situation, prices go up. If you allowed more competition, prices would head down. And a good example of that, for example, is the procedure that we do on people's eyes called LASIK. That's not covered by most insurance. So it's actually a market that's been allowed to flourish. And the price of LASIK has come down substantially over the years because there is all that competition. We need something like that. We need the types of initiatives I referred to earlier that enable people to choose the insurance or the medical plan that's best for them. And that will allow competition to flourish and costs to come down. And people will then be able to select plans based on the cost and the quality that those plans offer.
I would love the chance, Mimi, to discuss with Joel on a different show the care delivery aspects, because he's absolutely right. Something like LASIK that's paid by individuals creates a competitive marketplace. That's not true in the insurance world today. He talks about the 80%. This is what's called the medical loss ratio. 20% of an insurance premium is the maximum that an insurance company can keep for administrative costs and profits. It used to be often 30 and 40%. With the price of the insurance company going up, the less money of the premium that was spent on care delivery. I don't know how many listeners believe that they should be spending more than 20% of the premium on the administrative and profits of insurers. I don't think this is a good system. As I said, I don't think it went far enough. And maybe that's where Joel and I might disagree. The problems that remain were ones that could have been undertaken to create the competition that Joel is describing. We just didn't get there. I think it's a congressional issue. I'm not sure we're going to be able to address it in the near future, but until we do, listeners can expect the healthcare premiums are going to go up year over year over year.
I think part of the problem is, you have many people in Congress who decided that the solution to this is not to allow competition to flourish. It's to decrease competition, to have the government provide increasing amounts, perhaps all of our healthcare in this country. And that's just a recipe for rising costs, increased spending, and inefficient delivery of care.
All right, well, let's take a listen to former President Obama, who was back at the White House on Tuesday talking about the ACA anniversary and places where it still needs to be improved.
Even today, some patients still pay too much for their prescriptions. Some poor Americans are still falling through the cracks. In some cases, healthcare subsidies aren't where we want them to be, which means that some working families are still having trouble paying for their coverage. Here's the thing, that's not unusual when we make major progress in this country. The original Social Security Act left out entire categories of people, like domestic workers and farm workers. That had to be changed. In the beginning, Medicare didn't provide all the benefits that it does today. That had to be changed. Throughout history, what you see is that it's important to get something started, to plant a flag, to lay a foundation for further progress. The analogy I've used about the ACA before is that in the same way that was true for early forms of Social Security and Medicare, it was a starter home. It secured the principle of universal health care, provided help immediately to families, but it required us to continually build on it and make it better. And President Biden understands that, and that's what he's done since the day he took office.
That was the former president at the White House on Tuesday. Dr. Zinberg, your reaction to what he just said?
Well, I think when President Obama said plant a flag, he was actually being perhaps inadvertently very honest. Many in his party see the ACA as an opening wedge towards a complete takeover of healthcare by the government. So Bernie Sanders, with his proposal of a single payer system, would actually prohibit any kind of private insurance. And that's, as I mentioned before, that's just a recipe for disaster. It's a recipe for increased spending and inefficient spending and a lot of waste. So I think the president was honest. This was his vision for the future, and I think it's a vision we should resist.
All right, let's talk to Elaine in Blue Springs, Missouri. Hi, Elaine.
Hello, good morning. Two quick questions. One, if the ACA has a lot of emphasis on, I think they said, preventive care. Why, since the health of a person's mouth is so important to the health of the rest of the body, that it really does very little with respect, related to dental care? And then the second question is about that gap insurance. If you had employer, I think it's called COBRA. It is totally unaffordable. So if you are between jobs for any reason, you can't continue your health care. It really costs a lot. That's all, if they just respond.
All right, Elaine. Dr. Pearl, why don't you go first?
Two things. First, I agree completely with Elaine that dental care is essential. Our nation has chosen not to fund it for the people who otherwise can't do it for themselves. That's a social question and a congressional one. I think probably President Obama would have included that in the plan if he had his ability way back then, but that was not possible, again, politically. The other question is in terms of the Medigap coverage, is that this is an individual necessity to be able to buy it if it's not there, and that prior to the to the COBRA coverage, that prior to the ACA, what happened was that when you lost your coverage, you had to buy a plan that allows you to continue it. But since the people who lost it, who wanted to buy it, were the ones who were the sickest, the cost, as she said, was completely unacceptable. And the ACA provided an alternative. Rather than having to buy a plan that was going to be really unaffordable for almost everyone, you could now enroll in the exchanges during this transition period when you were an individual and no longer covered by your company. And it was actually a solution. I had a cousin who lost his insurance. He had a lot of medical problems. He ended up uninsured. He ended up with major medical issues because he couldn't get coverage. He couldn't afford his COBRA. Had it happened at the current time period, he would have been able to enroll with subsidies through the Affordable Care Act inside an individual exchange, and it would have made a big difference in terms of saving his life.
All right, Dr. Zinberg.
The reason the COBRA is so expensive is now the individual is charged with paying for both their part of the cost and the part of the premium that the employer was paying before. That's why COBRA is so expensive. Now, the ACA is an alternative, the ACA plans on the exchanges. However, those are expensive plans. Now, the typical plan for a family of four, when you include premiums and deductibles, is about $25,000 a year. So that is not an inexpensive plan. And if you don't qualify for one of the subsidies, you are going to be paying more probably than you would be paying for your other plans. So the ACA provides you the option of buying something, but it is not an inexpensive option. What we really need are things that allow you to make your health insurance that, as I mentioned before, most people get through their employer, to make that affordable. So, for example, health reimbursement arrangements, which was finalized by a rule at the beginning of, I believe it's January 2020, would allow employers to give you tax advantage dollars to then make your own decision about which insurance to buy. So in other words, you're not locked into the plan or plans that the employer selected. You get to take those tax advantage dollars, buy the insurance you want, and then take that with you to your next job. Again, utilizing those plans. That's, the Biden administration has not been terribly enthusiastic about any of the rules carried over from the Trump administration, but that is a real step in the right direction to allow people to make their own choices about what plan works best for them.
Dr. Zinberg, what do you think about the issue of dental care being included in preventative care?
Well, as was mentioned, dental care for, one reason or another has not been included in most health insurance plans. But, for example, Medicare does not have a dental coverage plan. So, that's a legislative decision. If Congress decides that it should be covered, and I'm on board with that, But you do have to realize once you start subsidizing something like that, generally the result is that prices rise. So you have to be very clear-sighted and careful about how you end up providing that coverage, because once you do that, it's often a recipe for rising costs.
All right.
Mimi,
yes.
For listeners who might get confused, the exchanges that we're talking about, these are individuals who are now looking to purchase coverage for themselves. These have major subsidies at the relatively low, by that we're talking about around $35,000 to $50,000 range, which is where the majority of Americans are today. And someone who finds themselves in the same place that Elaine was, where you don't have a job and you don't have income, you have subsidies to carry you through that time period. Now, at the national level, is there a cost? Absolutely. But I don't want anyone not going to get medical coverage because they think they can't afford it. And as Joel said, in the past way, COBRA became the full responsibility of the individual, and that was simply not affordable, and it was far higher than the average expense. But listeners who find themselves in Elaine's situation should go and get the coverage, and they can get that through one of the provisions of the Affordable Care Act.
All right, let's talk to Valdez in Mapleton, Illinois. Good morning, Valdez.
Good morning, doctors. Yes, I wanted to agree with Dr. Pearl about the money that's going to be infused, and it will not fix the problem. As a former soldier and retired state police officer from California, I've had insurance my whole life, never struggled for it, always been thankful, never took it for granted. I do believe that every citizen should have health care. We're not going to be like some of the countries I've seen where people are left to die in the streets. However, what neither doctor has mentioned today, the most critical part is that we need to be understanding that we are not citizens in this country, we're customers. You can't drive a street corner without seeing some fast food slop being offered for people to drive through and eat. Everybody's health, generally speaking, 2/3 of adults, I believe, are either overweight, obese. If we don't get that under control, and we won't because it's part of our economy, we will continue, like Dr. Pearl said, we'll implode. We won't be able to survive because our healthcare system will bring us down. So thank you for that, and I only hope that people realize that being unhealthy and then getting older when you're poor is a terrible place to be. I don't know either condition. So do what you will. Thank you.
Dr. Zinberg, your comments.
Well, I think, it's pointing out a very important problem. And this was a problem. I was at the Council of Economic Advisors from 2017 to 2019 working on health policy. And in our health chapter in the 2018 edition of the Economic Report to the President, we addressed this exact problem that the caller is talking about, that while the ACA focused on expanding people covered by insurance, that is not a guarantee that you're going to improve the health. In fact, the relationship between healthcare coverage and actual health is actually pretty minimal. I mean, there have been a lot of studies. Many of them find no relationship. The ones that find a positive relationship, it's quite small, and it's only for certain types of people with specific conditions. So the issue is not how do you increase insurance coverage. The issue is addressing the determinants of health. And obesity was one of the things we wrote about in that chapter, how obesity is an epidemic in this country. It affects our health much more than insurance coverage does. Another thing we wrote about was the opioid crisis, how that was leading to tens of thousands of excess deaths. So those are the real determinants of healthcare. Those are things that I was interested in then. Those are things I'm interested in now, or I'm a director of the American Public Health and American Wellbeing Initiative at the Paragon Health Institute. We're looking to address what are the true determinants of health, what can we do about that, rather than sort of focusing solely on insurance coverage.
All right, Dr. Pearl, any comments on that?
I completely agree. We have an epidemic of chronic disease. 70% of the problems we have in this nation tie back into that. They are preventable, many of them. They are treatable. Complications can be avoided, but it's not going to happen with the current healthcare delivery system, the fact that let's look at something like technology. You know, the most common way that doctors communicate with each other is the fax machine. I teach at the Stanford Graduate Schools of Business and Medicine, and when I tell students about the fax machine, they have no idea what I'm talking about. It's an 1834 invention. We need to change that delivery system to advance it. One of the principles in the Affordable Care Act that originally that didn't get carried forward and needs to be is creating accountable care organizations, bringing doctors together into groups, integrating them with hospitals, infusing it with technology, finding ways to deliver care that is higher quality, safer, and less expensive. But that still hasn't happened in this country. And I'll tell you, I'm concerned that when I look forward, unless we can accomplish something like that and make the investments, as Joel said, in the social determinants of health and providing care equitably to more people, we're just going to see this chronic disease get worse, and we're going to see cost rise, and we're going to see life expectancy, by the way, stay flat. It's been flat for 20 years in the United States. We're 5 years behind the European nations in life expectancy. We're last in childhood mortality. We have the highest maternal death rate. It was just published out of the CDC. We have double the rate of mothers dying from delivery. These are problems with healthcare delivery, and I think that needs to be a major focus for people. The ACA, I think, has become the target. It has a lot of problems. I'm not a true believer that it's perfect in any way. As I think President Obama said, it may be a good step forward. But the big opportunity, Mimi, is going to be around how do we change the delivery system to improve the health of Americans, and a lot of that will be around obesity, reducing diabetes, controlling hypertension, avoiding cancer, the things that we know that we can do as a nation, and we don't do it very well.
All right, let's talk to John and
Dave, I would like to mention something. So the Affordable Care Act and legislation the year before both promised that we were going to get this sort of renaissance in the delivery of healthcare if we only adopted all sorts of new technologies, electronic medical records, things like that, and if we adopted accountable care organizations, the ACOs that were just referred to. And there were a number of experiments that have been run over the last 10 years with accountable care organizations, with bundled payments, and they have largely been a bust. They have not delivered the kind of cost savings or quality improvements that were promised. So these are things that sounded good in theory. They're worth trying and perhaps worth trying again, but they're not the panacea that they were promised to be. And in fact, some of the requirements, like adopting electronic medical records and other requirements, have proved to be driving the increase in costs that many smaller providers face that they can't afford, and it ends up driving them into the arms of larger providers. So you've noticed the disappearance of individual practitioners or small groups. They all now work for hospitals. Those hospitals combine with other hospitals. So you end up with maybe one or two large providers in an area, which is a recipe for higher costs and less responsiveness to consumer needs. So those initiatives had a lot of unintended consequences. So we have to be very careful when you talk about proposing those as a solution to all of our problems.
All right, well, Dr. Joel Zinberg, that'll be the last word. He's the Senior Fellow at the Competitive Enterprise Institute and Director of the Public Health and Wellbeing Initiative at Paragon Health Institute. And we're also joined by Dr. Robert Pearl, former CEO of Permanente Medical Group, author of Uncaring: How the Culture of Medicine Kills Doctors and Patients. Gentlemen, thank you both so much for being on the program.
Thank you, Mimi.